urosepsis. Okay. What the doctors do is they start the patient, treating the patient as soon as they see the catheter. They start every single patient treating as a urosepsis, regardless of what is happening with the patient. Okay. They know the patient's complaints. They don't listen to what the patients are saying. They don't listen. They do not follow ABCDE. They start just following the catheter. As soon as they see the catheter, they say it's a urosepsis. This is okay. Or they will not treat the patient as sepsis if they don't see the catheter, which is again wrong. So you don't need to diagnose. Number one, urosepsis is not the diagnosis of catheter. Diagnosis of catheter. Not all the patients who have a catheter develop the urosepsis. Not all the patients who have the urosepsis have the catheter itself. Okay? It varies. So necessarily, you need to follow ABC. You need to follow the guidelines. Okay? That's the most important. And you need to follow the parameters for A, B, C, D, E. So which is what I said. Just in sync, you should be able to diagnose sepsis based on the parameters: temperature, pulse rate,
heart rate,
respiratory rate as well, pulse rate, heart rate,
ECG,
blood pressure. Yeah. So based on them, these are the parameters that we need to diagnose a sepsis. Not the catheter. What the candidates do is they start looking for the catheter. If they don't see the catheter, they don't start the sepsis. They know the temperature, very high temperature, low temperature, blood pressure, everything. They just get lost into their own dreams because there was no catheter. Did he need them? Or was it temperature? It was at 225. Do you not know that the low temperature is also one of the signs of the sepsis? A losing. Then why do you not give the antibiotics? So you cannot, just based on the parameter, you cannot really reach to the final diagnosis. Okay? If the sepsis is sepsis, it can be urosepsis, it can be chest sepsis, it can be some other sepsis, post of wound, abscess or anything. Okay? Regardless of whatever the sepsis is, there are certain parameters that change. Whether this is an intragluteal abscess, it's the abdominal abscess, it's the chest sepsis, urosepsis. They share the common parameters: capillary fill time, temperature, blood pressure, the pulse rate. Okay, these are the parameters. They will change. So you don't need to just look for the parameter. So follow the parameter, do not follow the parameter. Yes, there may be the catheter in situ with the dirty or clumsy urine in the lab. That's the case. You still start the antibiotics, IV, oxygen, blood glucose, lactate, okay? Sepsis 6 protocol. I mentioned that I will launch a chain of catheter. Okay? You don't need to do that. Okay? And another problem with the students is they don't start the treatment of anaphylaxis unless they see the blood angle. Okay? Because the GMC has asked that anaphylaxis scenario in the blood transfusion teams. They always think that it will be anaphylaxis will be only in blood transfusion teams. We have tried this so many times. You see a huge failure rate in our SIMMAN anaphylaxis reaction because our scenario is anaphylaxis to penicillin, okay, which is only good. When the candidates come for the mock, they don't give adrenaline because they believe it. But there was no blood. Why you need the blood? You need tongue swelling and the rest. Okay. So always follow the parameters. It can be anything. It can be peanuts. It can be latex. It can be antibiotics. It can be blood transfusion. Okay. It can be anything else. It can be street as well. Okay. So you need to follow the parameters, not not just the blood transfusion. Okay. Blood anaphylaxis can be because of multiple reasons. Look for the signs and symptoms. Treat that as anaphylaxis, and similarly, urosepsis is not the diagnosis for the second. It's a sepsis. It can be because of any reason. Look for the parameters and treat them accordingly. Another confusion is when to put the point. As one or patient is stable, normal oxygen, maybe supplemental oxygen, plus another person. We have covered that. Then we covered that ischemia, something as well. So when to put the candle? They will say patient needs IV naloxone. So for example, in B, patient has a problem with the low respiratory rate, and you suspect that the patient has opioid overdose. They are very hesitant to say, I will give him IV naloxone. Why? Because we have not done C, and when we do C, then I will put the cannula and then I will give IV naloxone. What if we find something else in C? We forgot to mention about B. Okay? The patient will be dead. IV cannula is an additional route. It is not the part of the assessment of A or B or C or D or E. Okay? It is not the part of A, B, C, D, E. IV cannula is an additional route in addition to the oral, muscular, subcutaneous, or rectal. This is the additional route of delivering the drugs wherever or for whatever reason you need it. Whether you need it to treat A, you need to treat B, C, D, E. This is just an additional route. You take the blood samples as and when you do the cannula. Okay. Let's say for example, this patient has a low respiratory rate. This is just an example. Low respiratory rate and hypoxia. And I'm suspecting that there is some overdose. Look in the pupil, the small. Okay. I'm saying, Mr. Smith, I need to give you IV naloxone. Okay. Take the cannula, put on here, and mention that. I will also take a few blood samples at the same time. Okay, take the blood samples. So taking the blood samples also are not bound to see. Okay. Now, what blood samples you need? When the patient is acutely unwell, you do not necessarily need to complete the full assessment. Take the blood samples. It is an opportunity to take the blood samples as soon as you provide the line, or you try to take them from the same cannula that you're putting, and take all the blood samples, all the routine specialized, specific blood samples that you may need. Many of the time we close the additional sample. Okay? But we take, say for example, the patient was acutely unwell at any point, I need you to the cannula, I will say, okay, Mr. Smith, I need to give you the cannula, give you some antibiotics, naloxone. I will take a few blood samples of you. Take all of the problems. Then I will decide after completing the assessment, alright, so thus we have already taken the blood samples. Let's send them for this. Okay, that's all. But we have already taken The nurse will say, doctor, there's one more. Did you need this bottle? No, I think we don't need it. Then, what? Oh, okay, let's see what we need. When we need, is a patient on anticoagulants? No, doctor. Oh, yes, doctor. Okay, let's then do the focus. You take the blood samples. When you put the cannula, wherever you put the cannula. Cannula is a part of your intervention. Okay, it is an additional tool in addition to the oral, subcutaneous, muscular, intramuscular, and oral. So you use an additional one. Okay, so do not wait till C to complete the C, then you after completing the C you say, no, I will put the cannula. And what your examiner will be noticing that this doctor is so nonsense, he ignored the hypoxia and low respiratory rate. He didn't say any single word about analogy. He moved to C. Here we go. Okay, and the doctor is in a bleed gap. If I say IV naloxone, then examiner will analyze. And he delayed and delayed and delayed, completed the C, the patient's hypoxia has gone down to the bottom. Okay, the patient's respiratory has gone down to 0. And now he is saying, I will give him the naloxone because now I have to do the cannula. And the patient is dead, right? At least you are dead. You will have to pay 943 pounds again. Okay, come again. So don't make silly mistakes. Especially when you know the things. This SIMMAN Session is very easy, very much doable if you follow A, B, C, D, E. If you are not confused, your examiner is not judging you. Okay? He is there to mark you against your performance. You think that your examiner is not there. Okay? All your interaction has to be with the patient. Okay? Now we're going to start. I will show you a video of me, I believe that you have not seen. Okay, let's talk about before we go to the next assessment of unconscious patient. Dr. Salvo was going with that. That's the last book that I'll show you the similar scenario done by myself. Okay, then we will do now assessment of unconscious patient. If the patient is unconscious, are you aware of the BLS program? BLS, basic life support program. Check for the response. Response, nothing. So the first thing that we will do is, if the patient is unconscious, check for the response. So these are the two things that we need to do. Okay. The patient should have no response and not breathing to qualify the CPR. If the patient is breathing but not responding, you follow A, B, C, D, E. Sabia, it's very important to do. If the patient is not responding but breathing, we need to follow A, B, C, D, E. If the patient is not responding but breathing, we need to follow A, B, C. If the patient is responding but not breathing, we need to follow A, B, C. But if the patient is not responding as well as not breathing, we need to follow BLS. chest breathing. Which means CPR. So if you go and see your patient, SIMMAN, he is not responding. You should try to get the response. How we check the response? We just talk about that by using A, B, B. Okay? Just note, even a sleeping person is unresponsive. If someone is sleeping and you say, Mr. Smith, hello Mr. Smith, I'm not responding, he does not need this. Okay? What effort? So you need to show your examiner as well that you made some effort to get the response. Mr. Smith, hello Mr. Smith, no response. Mr. Smith, no response. Mr. Smith, no response. Qualified one, no response. Okay, let's check the breathing. Is he breathing? Yes. Okay. Look at this. Then open the mouth, look into that. B, C. Then in D, now you do all the scan, people temperature, glucose and everything. Okay. Now, by doing this section, you diagnose where the problem is. Breathing is normal. Response is D. What comes first? D. If D is stable, then you have the time to check, to go to D. Okay? Then you follow A, B, C, D. The patient is clear. Is it clear? Any confusion? Yes or no? So, look, listen, feel. Are you going to check the breathing? Look, listen. No response. Mr. Smith, hello, Mr. Smith. Mr. Smith, hello, Mr. Smith. No response. To the pain. Okay. Let's check the breathing. Bend down. Look, listen, feel. You are looking for the chest wall movement, listening to the breathing sound, and feeling the warmth of the breath. Not more than 10 seconds. But if your patient is already connected to the monitor, it's okay. Happy days. Okay. Look from the oxygen saturation, breathing is already coming there. Okay. That reassures over the patient is breathing. We're not talking about A. We're not skipping anything. We are just assessing that the patient needs a BLS. If the patient does not need BLS, now you open the mouth. Okay, now you start releasing. Okay. Look in the mouth, look for the body, oxygen. Okay. Now come down. Initially you just check the patient breathing. Now you are going to characterize the breathing. Okay, by checking the breathing. Bend down. Okay. Look forward. Chest wall movement. Okay. Hold the chest. Tap, 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 tap. Okay. Listen to the chest on both sides. Auscultation. And do the practices in the chest. Surgical imaging. And completion. Okay. Again, go back. Okay. Make sure that oxygen is blistering. The mask is blistering. Okay. When you see the mask is blistering, that means the patient is breathing. Okay. If you see the blister in the mask, and you go to circulation. If you leave the time, your examiner will say 2 seconds or 1 second. Alright. Pulses, they are all present. Okay. Good volume, batteries are cold or warm. Okay. You give the answer. Okay. Now let's see. Check C on the patient. Now going to the monitor. But in 5 parameters maybe. Okay. Listen to the far as well. Okay. Now look on the monitor. Looking at the monitor, what is the rational pulse rate, heart rate, ECG, blood pressure, temperature. Whatever abnormality you found, IV fluids, IV antibiotics, and put the cannula in all the procedures. Then now comes the D. The problem we diagnosed with the problem was B was okay, patient was breathing, but he is unconscious. Now we do all D. All the 4 parameters, check for the responsiveness. Mr. Smith, now you're going to spend more time. Mr. Smith, hello, Mr. Smith, hold it. Okay, Mr. Smith, open your eyes. Okay, or show me your tongue. Straight your tongue out. You're trying to get the response. You're spending more time because now you're happy. A is stable, B is stable, C is stable. He's just unconscious because he was prone. At the moment, he is on high. Okay, he just won't go. Stay like this. Worried about that. Plus, you're going to check the glucose. You're going to check the pupils as well as any drugs that the patient is on, especially those which are centrally active. Are we clear about how to assess unconscious patient? A, B, C, A, B, C.
So how are we going to address the patient when we talk to the
Yeah,
client?
no, you can simply you can self-talk or you can.
I'm going to check this pulse.
Yeah, you can then in that case, just a few cases, in that case as well, you can tell your examiner, I'm happy with the circulation, examiner, I'm happy with the air now, I'm happy with the breathing, if they know. But if the patient is conscious, all your consultation conversation has to be with the patient. Okay, now I'm going to play a video for you all, but I want you to go watch and see how are you being affected. They may be, they're not very professional, but they are very good clients. With the limited resources, we try to create a kind of simulation so that you get the idea how to interact with the patient and what the things are. I'm going to start with the assessment for unconscious patient that we just talked about.
Hi,
Hi,
Mr.
Mr.
Davidson.
Davidson.
Hello,
Hello,
Mr.
Mr.
Davidson.
Davidson.
Mr.
Mr.
Davidson.
Davidson.
Hello,
Hello,
Mr. Davidson.
Davidson.
He's not responding. Let me check his absence situation, please. Low. Strong patient on high flow oxygen. Seems okay. Clear trachea. Surgery. slow. Very short period of time. Okay, I'll give naloxone because apparently it has low sensitivity. That's what I found with the hydrogen. There's got cannulas. So naloxone 200 microgram. Mr. Davidson. Hello. Mr. Davidson. Pulses. Okay, so all the pulses are present. Happy with that. We got the fluid going on. Okay, we'll check the pupils again and see the response. Mr. Davidson. Hello. Mr. Davidson. Okay, the pupil size is still low. I'll give another dose and check the glucose as well. Okay, so glucose is fine. People are still constricted. I'll give another dose of naloxone 400 this time. Mr. Davidson. Hello. Yes. Okay, before we check the blood pressure, can you check the blood pressure, please? Okay, the blood pressure seems okay. Mr. Davidson. Hello. No worries. I'm one of the doctor. My name is Dr. Raza. You was slightly unconscious just a few minutes ago. Okay, tell me where the pain is exactly. Okay, is it very process? Okay. Let me have a look on your wound. So this exposure is not actually exposure. Is it really connecting to the dots. It's okay. Tell me, is is still soft. I'm happy with that. So, Mr. Davidson,
2 minutes remaining.
it seems that you've been given morphine bit in excess. Okay, that can happen if you have eye pain, and so what we need to do is we need to stop the morphine so that it does not cause any impact on you. Okay. So I will give you paracetamol. Are you allergic to any medications at all? Okay, no worries. I will give you paracetamol and maybe consider giving ibuprofen if your pain comes back or if it is not under control. Okay, I will be around. Unfortunately, we cannot give you loads of morphine. I'm happy to discuss with the pain team if needed. Okay, let's see how your pain control works. Okay, I'm going to continue with the paracetamol and ibuprofen. Okay, is there anything that you want to ask? Okay, let me check your numbers again. Okay, your oxygen is better and respiratory rate is also better. Pulse, blood pressure, temperature, they're all fine. Okay, so okay, now I will talk to the examiner. Okay, examiner, I was called to see Mr. Davidson, who is 67 and tracheotomy. Apparently, he was unconscious, which is why I was called. And on my assessment, all the parameters were normal apart from hypoxia and lower respiratory rate. With the people had a look at the drug chart, he had quite a few doses of morphine. And according to my assessment, he had
Sound is not very loud. I think.
Yes.
The
keyboards is complicated.
He's back to himself and
Move on to the next station.
Any question? That's really nice. This is not working. With the AC.
Beginning your task.
After this, we're going to take 10 to 15 minutes break, and you both will be the first one to go. Okay, try to make sure that you follow the structure. Today, what I want to see you showing is that you're able to follow ABCD. I'm not worried about if you give any wrong clues, but next time, you should be on the top of everything, no more mistakes. What do you think is going on?
I was initially thinking sepsis, but then he's reacting to the antibiotics, probably a reaction to the antibiotics.
Could be both.
It might be.
Begin.
Could be both of them.
Hi, Mr. Clinton.
Hello.
Hello.
Hi,
My name is Dr. Hazan. I've been told that you're not feeling well. Are you okay?
Okay,
Okay, don't worry. I'm here to
you.
help
Okay,
you.
I'm
Okay, I'm
told
told
that
that
you're
you're
given
given
some
some
medications.
medications.
Any
Any
problem
problems with throat? So,
Okay, let me have a look into the throat.
Oh, your throat
To
seems to
be
be
a bit
bit
blocked,
blocked,
okay?
okay?
Let me
Let
check
me
the
check
oxygen
your oxygen
saturation.
saturation.
Alright, okay.
Okay,
The
the
oxygen is
oxygen
very
is very
low.
low.
You've been
You've
given
been
the
given the
medications and
medications and
after that you
after that you
started
started
feeling
feeling
unwell,
unwell,
is it?
is it?
Okay.
Okay.
It is
It is
possibly a
possibly a
reaction,
reaction.
okay?
Okay.
Are you
Are you
allergic to any
allergic to any
medications at
medications
all?
at all?
Yes, I'm allergic to medicine, man.
Oh,
Oh,
okay.
okay.
I think
I
it's
think it's
allergic to
allergic to
comoxiclav.
comoxiclav.
Let me
Let
give
me
you the
give you the
medication
medication
quickly.
quickly.
Okay.
Alright.
Um,
Okay, here's
here's
adrenaline.
adrenaline.
Given 1
One
into
and
0.5
1
mils.
mils.
Okay, you
Okay,
will
you will
start
start
feeling
feeling
better. I'm
better.
gonna
I'm
give
gonna
you
give you
oxygen.
oxygen.
Okay.
Okay? Please bear
Please
with
bear with
me.
me.
Okay. You'll
You
soon
soon
start
start
feeling
feeling
better.
better.
Don't you
Don't
worry.
you worry,
Okay.
okay?
Let me
Let me
examine your
examine your
chest. I'm
chest.
gonna
I'm gonna
expose your
expose your
chest a bit.
chest a bit,
Okay.
okay?
Okay.
All right. Feeling your trachea,
Here.
and I
And
can
you
see
can
the
see the
rashes all
rashes
over
all
the
over the
chest.
chest.
Okay. Are you
Okay, are you
sore
sore
anywhere in your
anywhere in your
chest?
chest?
No.
Okay. Take deep
Take
breath
deep
in
breath
and
in and
out.
out.
And
And
again.
again,
Okay. Let me
let me
listen your
listen to the
chest.
chest.
Okay.
Deep breath in and out. Okay. Deep breath
Deep
in and
breath in and
out.
out.
And
And
again.
again.
Some
Okay.
breezes in the chest.
Your chest is
Chest is
very
very
wheezy at the
busy at the
moment.
moment.
Okay. I
Okay,
need
I
to
need to
give
give
you
you
salbutamol.
salbutamol.
A bit
A
of
bit of
nebulization.
nebulization.
Okay.
Okay?
Okay.
I'm gonna
I'm going to
replace the
replace the
mask.
mask.
Are you
Are you
feeling any
feeling any
better?
better?
Yeah, I'm feeling better now.
Okay.
Okay,
Thank you.
thank you.
Let me
Let me
check your
check your
numbers
numbers.
in the respiratory rate. Okay, it's 24. You're breathing
Breathing
fast.
fast.
Your
Your
oxygen
oxygen
saturation
saturation
has
has
improved on
improved
a
on a
gradual
gradual
path.
path.
Okay,
Okay,
let me
let me
check
check.
your circulation. 1, 2, 3, 4, 5.
Five.
What is
What
the
is the
category for
category?
timing of your patient?
It's 3.
Okay. You
You
seem a bit
seem a bit
dehydrated,
dehydrated,
Mr.
Mr.
Clinton.
Clinton.
I need
I
to
need
give
to
you
give
the
you the
fluids
fluid
and
and
give you
give you
antibiotics as
antibiotics.
well, okay? I
I
understand that you've
understand
been
that
given
you've
the
been given
antibiotics. It seems
antibiotics.
that they are not working. Your temperature seems to be high, okay? I'm taking your blood samples, putting a cannula, and let me feel the pulses as well. Okay. Checking the pulses in your feet as well. Can you feel me just there?
Yes.
Okay. Give me that, please. I need to complete that part as well. So, Mr.
Mr.
Patrick,
Patrick,
let me
let me
feel your
feel your
pulses.
pulses.
Okay.
Okay. You sore
Or
anywhere in your
anywhere in your
feet?
feet.
No.
Okay. I can
I
feel
can
the
feel the
pulses.
pulses.
I'm going to
Going
put the
to
cannula
cannula
because your
because your
blood
blood
pressure is
pressure is
low.
low.
Okay.
Okay, and your
Okay,
pulse
your
is a
pulse
bit
is a bit
high.
high.
Putting two
Putting two
white blood
white
cannulas,
cannulas.
and we'll take the blood samples. Blood cultures. Okay. You're
You're
allergic to
allergic to
penicillin, so I need to
penicillin.
start you
Start
on a different medication. I will
I
give
will
you
give you
paracetamol. You
paracetamol.
okay
You
with the
okay with the
paracetamol?
paracetamol?
Yes.
Okay.
Okay.
So the
So the
paracetamol is
paracetamol is
gone,
gone.
and let's give you the fluids. 1 liter of normal saline. So I've
So I
started you
started
the
you with
fluids. I've
fluids. I
checked with the
checked with the
microbiologist
microbiologist
before I
before I
commence any
commence
other
any other
antibiotics. Okay.
antibiotics. Okay?
Please don't
Please
you
don't
worry.
worry.
How is your
How is
chest
your
going
chest
at the
going at the
moment?
moment?
Yeah, I'm a bit better now.
Okay.
Okay,
Thank you.
thank you.
So do you
So do
know
you
where
know
you
where you
are?
are?
Yes, exam in the hospital.
Okay, okay. Let me show you bright light in the eyes. Okay,
Both eyes are active equally.
okay. All right. Can I have a look at your report again? Sorry.
Okay.
That seems better. Are you feeling better now in your throat?
Yes.
Okay. Now I'm going to check your glucose. Are you diabetic?
No.
Okay.
2 minutes remaining.
How's the glucose?
515.
All right. So I will have a look on the drug chart. You're allergic to penicillin, but it's not written there. I will make sure that it is documented. Check all the medications study on the right medications. Okay, thank you. Let me expose you fully and examine you from head to toe. Okay. You can see the rashes are fading now. Okay, there's nothing major obvious. Let me listen to this again. Your V's is still there, it is better than before, so Mr. Patrick, I'm really sorry that this has happened. I will do an incident report for you. Okay, it could have not happened, and we'll continue the medications. I will check with the microbiologist to give you another medication, okay? I will ask you to keep an eye, and we'll follow the bloods and we'll chase them up and start the medication, come to the medication as deemed necessary according to the blood results. Okay? So don't you worry. I'll come and see you again. Okay, I'm around. If you need any help, please let them know. Okay? Thank you. Your temperature is still high. Very likely you will get better with the paracetamol, but we will need to give you antibiotics. How is your chest going at the moment?
Yeah, I'm a bit better now.
Let me listen to your chest again.
Continue reassessing when you have some time. Okay, spend the time with the patient.
Your V's is still there, it is better than before.
Move on to the next station.
Stay calm as long as you know your ABCD. Any conclusion or questions? So we have seen now two scenarios, one conscious patient, the other one unconscious. With the unconscious, as we discussed before, response and treatment. These are the two priorities first of all. GCS is not a priority. The patient may be confused or may be very drowsy, but if they are responding, it means that we can carry on with the ABCD. If the patient is breathing, we can carry on with the ABCD. Try to show your examiner that you are actually trying to get the response. Okay? Not only just Mr. Smith, hello Mr. Smith, then you say CPR. Okay? That is not the way. Okay? Now we can take 10-15 minutes break. It's 25 past what? 4. Okay. So let's make it 40.
Sir, in this case, first you gave him antibiotic, once you
Adrenaline, yeah.
adrenaline to date, उसके बाद you move to the then you wait. So उसके बाद you give paracetamol and you said antibiotics you mentioned, and I'm going to give you fluids. And then later on you give wide word cannula. I want to ask you पहले तो दे दी.
Because the patient already had the cannula, if you see the video, the cannula is already there. But this is the formal protocol that we need to follow. Okay, the first thing that you need to do is the tongue swelling, airway. Okay, sepsis is causing the trouble in the C. C comes later. Okay, secure the airway by giving adrenaline and giving oxygen to maintain respiration. Okay?
And another thing you mentioned in the beginning that you saw his mouth. तो वैसे मैनेकिन पे क्या नजर आया? What would be the findings?
In the mannequin you will be able to see the uvula and the tongue.
Okay.
In the SIMMAN. Okay, when you go there in the UK, you will have that typical and you will be shown everything. Okay, so you will be able to see the tongue swelling, you will be able to see the disappearing uvula, you will be able to feel the pulses and listen everything. Okay, this has a limited functions. Yeah, even if you want to bring them, those any technical support will not be accessible for us. So break. Yes. We'll come back. Sure. हाँ जी कैसा फील हो रहा है आप लोगों को अटेंडिंग गोइंग थ्रू अ बिट ऑफ दैट तो तसल्ली हो रही है यार आप कर सकते हैं सिमरन ठीक है यू नीड टू लर्न ओनली वन थिंग द अप्रोच उसके बाद सोर्स एनालिसिस भी कर सकते हैं और ये सिर्फ हम ही करवाते हैं एवरी मंडे व्हेनेवर यू गो आप जब भी मंडे को जाओगे वहां पे सिमरन नहीं हो रहा होगा ठीक है डेडिकेटेड डे फॉर दिस ठीक है फिर जब आप ये कर लेते हो you know that you will be making mistakes we give you a bit of time थर्सडे तक आपके पास टाइम है आप डेली इंप्रूव करें थर्सडे को जाके एक्चुअली फीडबैक लें वन टू वन नो वन एल्स डज तो किसी भी एकेडमी में सवाई एक बार दिखाने के सिमरन को हाथ में लगाने में ठीक है और वो नोट्स एवरीथिंग पढ़ेंगे वी टीच अब मुझे ये पता है कि विद ऑल दो स्किल्स when you touch the floor of the hospital you will be very confident अगर आपको पता है कि मेरी approach क्या है you will be in different level of the confidence तो हम यही करते हैं इसमें भी कोर्स में भी जो हम फाउंडेशन we try to build the skills not build the scripts so practice feedback we try to work on that okay? So just be confident, practice, go through what you learned, and practice more. Yes.
चाय वगैरह पीनी है हमें किसी ने जाके अंदर से बना के पीना है कैटल पड़ी हुई है सारा कुछ पड़ा हुआ भाई मैं पूरी पूरी होता
और टीवी बैग हम बुला रहे हैं हमें ये वाली चाहिए ज़्यादा थैंक यू चल तो आपने डिनर कर लिया चल चल
और इनमें से किसी वार्निंग कारण जो है सीरियस पर प्रैक्टिस करें, इधर ही प्रैक्टिस करते जा रही है, इधर देखिए चीज़ें पढ़ें, प्रैक्टिस करें, ताकि इन्हें परमानेंट मेमोरी के सवाल नहीं, अगर फिर जाकर दोबारा पढ़ेंगे तो ऐसा तो दूसरा नहीं होगा। और कल का काम करना है, सब उसका आवेदन कर लेना, तो जो भी सिलेबस है उसकी वीडियो या जो भी सीखना है वो देखते हैं, अगर आप जब पढ़ेंगे आवेदन के लेक्चर का ज़्यादा ट्रेनिंग होगी, अगर आपने पढ़ने से होगा नहीं, हम इस वगैरह उनका वीडियो देखिए पढ़ना, पढ़ाई में फिर आप शुरू करते हैं बार बार बिल्कुल सुने कि हम यार ऐसे ऐसे करें, ऐसे ऐसे करें, ये वो चीज़ें आपका सामने होना चाहिए और ऐसे करिए वो नहीं आइडिया मेरा ऐसे आना था ना सेशन की नोट्स को बनाने के लिए फॉलो करना है मतलब एक हमारा लगे ना हमारी बातों के प्रोफेसर है ना वो बुक को नहीं सुनते हैं तो पुरानी लाइन की लाइन जो सबसे जो गाइड करने डेफिनेशन लिखी है उसमें वही सुनने सुना मैंने बनाने राइट ये एग्जाम के अंदर पे राइट मतलब बहुत ही कितना क्वेश्चन ज्यादा टाइम एक बार फिर स्टेट का एग्जाम आपसे पूछो तो आपका टाइम वंस आप मैनेजमेंट में एंटर हो गए ना आपका टाइम खत्म अब आपने कम से कम होना पेशेंट से ज़्यादा पूछना पेशेंट को ज़्यादा सुनो बातों करते हैं आप सब बात करते हैं ट्रीटमेंट है मैनेजमेंट पॉलिसी को प्रमोट करती है बार बार पेशेंट का कंसर्न वही होता ही नहीं पेशेंट वही क्या नहीं रहा होता पेशेंट क्या होता है कि मैं आप राइटर्स का बिल्कुल स्वागत है मेरा कंसर्न मेरा वॉशरूम शेड्यूल सेट के ऊपर फॉर स्लो होता है मेरा कंसर्न भी कुछ और
So you don't take a consent to activity consent.
But then how to use the other idea, use this idea, use that idea, that. हमारा डेढ़ समझ माना यदि आप सुनाने पहला डॉक्टर सेंटर हो जाता है अभी हमको आपको मैनेजमेंट एक मिलता है 4 मिनट यार मैं अच्छा ट्रीटमेंट सुना है जी इसलिए एक वही मैनेजमेंट करने हैं आप ना पेशेंट के लिए आप पेशेंट का वगैरह का मेन इशू इसका मेन कंसर्न है कि नॉट स्टेट आपको पता है ऊपर रहेगा बाबा प्राइवेट में होगा वर्षों में और मेरा पूरा बड़ी चीज है तो मुझे नॉर्मल प्रोफेशनल सर्विस हम then make certain things they might follow that put an electric chair so that it can move easily downstairs to upstairs or sound sheet get on that sound and here that I can use for get over back pain yes pain will be used for the pain classical ibuprofen इस तरह अब हमने सुना होता है हमने पैराडोल देनी है एनासिड देनी है फिर हालना पड़ा थोड़ा सा टीका लगवाएंगे शुगर के बाद ये आपकी
नहीं वो आ रही है
बड़े बहुत स्वस्थ हो
नहीं
लेकिन मैं शाम को रात वापस जाना
सबसे पहले लिखा होगा
हम तो जब कराएंगे Hello, Mr. Adam, can you hear me? Hello, Mr. Adam. Say it.
जैसे सर
Hello, how about you? Hello, Mr. Adam, can you hear me? Hello. Hello.
ये सही पढ़ना है
हाँ.
अभी पढ़ना अब इस समय क्या है ना उर्दू में कहेंगे जज्बाती नहीं होना तो पकड़ने ना लगे काम करना तो फिर है नहीं समझ के शेड्यूल में स्टूडेंट के कंफर्म है अगर आइडेंटिटी तो कंफर्म करें आपको प्लेस नहीं भी जाए हेलो एलेक्स कैन यू प्लीज जाए पास जज्बाती होना हेलो हेलो चलना नहीं करना
सही है.
एग्जामिनर देखा काम को आप खुद ही घबरा रहे हो इमरजेंसी में क्या टांगे तो नहीं काम पहले आइडेंटिटी तो कंफर्म करें कि मेरा पेशेंट है मैं सही पेशेंट के पास आई नहीं हूँ लेकिन रिजल्ट के पास आ रहा है तो एक पेशेंट है लेकिन आपने शो करते हो सेफ्टी के फॉर्म में फिर मैनेजमेंट पेशेंट पहले सो फिर शिफ्ट होगी चीजें अब कहना है दोबारा करें पहले पूछो तो सही हेलो
अच्छा बस हेलो बोल.
पहले हेलो हेलो करें आपको जवाब नहीं देगा पूरी
Hello, can you hear me? Yeah, I can see that my patient's name is Mr. Alex.
आपको कैसा लग रहा है एग्जामिनर न्यूट्रल बताना कि इन्होंने जब सारी ब्लड से चेक की है
लड़ाई हो जाएगी
देन लाइक वेट देखना है
Say it. Hello, good
ऐसा
afternoon.
तो मुझे लग रहा है स्क्रिप्टेड है आपको पता पेशेंट हम पहुंचने वाले हैं यहाँ पे जाना है ऐसे जाना है चल तो और करें
Hello, good afternoon. अब तो
आज तो जाना ही नहीं है लोग ऐसा क्या
अच्छा say it, okay.
नेचुरल
Hello, good
स्क्रिप्टेड ना लगे
afternoon. Okay, as I can see that the patient's name is Alex.
as I can see my patient is let me check confirm his
Let
identity
me confirm.
and now hello
Okay, let me confirm my patient's identity. His name is Mr. Alex. Mr. Alex, can you hear me? Hello, Mr. Alex. Are you there? Can you hear me?
Good. अब ये नेचुरल था
अब चला है
फिर ठीक है ना फिर सही हो गया लेकिन अब ये नेचुरल था
सही है
ये सर आपने नेचुरल बिहेव करना है rather than
Okay, as I can see that Alex is not responding,
and he is breathing
नहीं, can I check
and let's
now?
look
Let me look for his chest. Okay. Yes, I can feel the warmth of his breath. Now,
I can do the chest of my patient is moving
and
I can hear the sound of breathing and I can feel the warmth of his breath.
Okay.
So I will start
So now I will start with the
ABCD program.
Will?
आप बोलना है अब आप I will start my session on the
I will
basis of
start my
ABCD.
assessment. Okay, on the basis of ABCD. Okay. So first I would like to check.
पहले क्या कर रहे हैं पहले रेलवे देखना फिर वहाँ से कंफर्म करना
Okay, are you ready now? Sorry. It's okay. Everyone. It's okay.
यहाँ पे एग्जाम में उसका फायदा लर्निंग है ना
That's okay. You are allowed to make mistakes now. Sam?
एयर में देखेंगे ना एयर में देखेंगे
His mouth was flared.
पहले कितना दोस्त ना कीजिएगा उसके सीमेंट में नहीं ना पड़ते जो रात में आया होता है
Okay. Now, what do you expect to be doing? Okay, just quickly, guys, when you go inside, there will be SIMMAN, there will be monitor, there will be a trolley to the side, and the examiner. And you assume that the examiner is not there. He is just assessing and mark all your performance. They don't trick you. Okay? And at the same time, they don't have to. A few of the examiners sometimes they may be helpful. Many of the time they try to help you in a way that you reach to the point where exactly the problem is lying sooner rather than wasting your time about time in doing other things. Okay? But you show them that you have ABCD protocol, you know how to follow. Say for example, if the patient has a hypoglycemia and you go to listen to the test, they may say it is clear. It means that they want you to move forward. Okay? Well, you're not supposed to be asking, if they're not giving you any prompt, you're not supposed to be asking, examiner, is the test clear? Because the SIMMAN is supposed to give you the findings itself. Okay? If there is any problem, like if there is any V's, you will listen the V's. There's no one going to say that there is a V's in the Okay? Make sure that you keep that in your mind. If someone says, when you say take deep breath in and out, they say it's normal, it means that only this part is normal. It does not mean that you skip deep altogether. Okay? Only this is normal. Now you move to this, let's say normal, it means that you move to the next. Okay? Then you listen to it. Okay? Can I have the mask and the other presents? Okay. They will be following the label A, B, C, D, E, or airway, breathing, circulation. So, the things which are relevant to them, to the airway, you will find in A, and the things which are relevant to B, you will find in D. Similarly, C, like the cameras, person, and bottles and stuff, you will find in B. Okay, this is non-lead mask. Okay, this is used for the high flow oxygen. When you want to deliver high flow oxygen, it has the valve on one side. Okay, oxygen goes to this, and you just need to put this on the face of the patient. Okay, when you put this on the face of the patient, that means you have done that. But if you simply say, I will give you oxygen, but you have not put this on the face, it means that you have not done. Seeing the things does not mean that they automatically happen. Okay? If you want to check the glucose, it is important that you get the reading. Just simply saying that I will check the glucose does not mean that it is being tested. You need to get the reading, okay? They know what's the glucose. When you say, I will check blood pressure, it does not mean that you have actually checked it. It just shows the intention. You want to know what is the blood pressure of the patient. Okay? So this is a non-lead mask. The patient cannot breathe into this. Okay? It has a valve and the breathe out. Those valves will open and they will let the CO2 exhaled air go out. And when they inspire, they will take pure oxygen into the lungs. Okay? This is a non-lead mask. Then this is a nebulizer mask. Okay? These are the venturies. Okay? Venturies. They are of different colors. Okay, depending upon how much oxygen for the sake of your examination, just choosing any venturi is enough, okay? Because you are not doing a membership exam or the ITU or MSCS exam. Just that you select any venturi if the patient is a COPD, okay? Whichever color you have or whichever is nearest. Take that. And tell the patient that I need to do a blood gas from the pulse. Okay? When you say blood gas from the pulse, it means for the examiner you're talking about the ABG. But if you say your patient that I need to do your ABG, that will sound a bit more medical term. Okay? You can tell that I need to check the blood test, do the blood test, check the oxygen from the blood test. Okay? From the pulse. Alright. This is a nebulizer. This is a nebulizer, and this is a mask, and this is a venture. Okay. I believe in what in the UK you will find. This is a pre-assembled. So in the UK you will find different stuff. So you need to put this if your patient needs a venturi mask. Okay? Mask will be separate from the venturi. Okay? Most of the time. Mask separate from the venturi, so you assemble them, make the venturi mask and put on the face. Remove this and put in the face. Okay? It means that you have done. You don't need to connect it to the oxygen, you don't need to do anything, you do not need to even run this behind the head, but make sure that it is strong enough, static, and it is not broken. Many of the doctor in stress, when they're anxious, they put this way. Okay? Don't do that. Or when you want to give them put the cannula, you don't need to actually insert the cannula. You just put them by the side of the patient. Do we have another cannula? There was one more. Yeah. So ideally they should be pink or red or green or green. Okay? So put two on sides. It means that you've done it. Is it making sense? But if you simply say, I will give IV fluids and put the cannula, it means you're not doing anything. You have not done, you simply expressed and the patient will not improve. Okay? The patient will improve only if they're meant to be in response to the fluid. If you pick the bag of the fluid and there will be a hanger on the drip stand by the side of the patient, you hang that. Okay? So you need to pick that from the trolley and hang it with the drip stand. It means that you may feel sometimes difficult, short stature, doctors, you cannot reach, or there is obstruction, okay, it's placed on that side, you cannot reach it. Okay, in that case, you simply pick that IV fluid, okay, put by the side of the patient, it means that you have done. But because you cannot reach, if you don't do that, it means that you are not doing it. You simply express it. But you need to do that by your actions. Okay? Pick from the volume. Is it making sense?
So do we need to put two cannulas when we are putting?
Regardless.
Okay.
Regardless. Okay? And do not delay putting the cannula even if the patient's blood pressure and the pulse are fine. Okay? Even if, say for example, the patient with the recurrent falls or the dizziness, his blood pressure is normal and his pulse is normal, and there is no point. They still need to wide open. Okay? And you act before the patient deteriorates. You never know what will happen in the next 2 years. Okay? That's the best time when the patient have good veins, palpable veins that you can approach. When the patient deteriorates and remains difficult and they're not able to find any veins. Okay? So it is important all the patients, especially the SIMMAN, and in your real life, any patient who is acutely under, who might go to campus. Okay? On both sides. You just need to put one here, put here, this is the fluid bowl, okay, and the oxygen is going on the face. Alright? Do you want to give the patient oxygen as well as salbutamol? Say for example, you can simply verbalize that I will give oxygen, salbutamol to oxygen, which we call as oxygen-driven salbutamol. Okay, oxygen-driven salbutamol. Alright. So here you connect the oxygen instead of connecting this to the machine. Here you connect the oxygen. They will get salbutamol plus oxygen. Okay, they are on this strap. You don't need to take any blood sample actually, but if you want to take any blood sample, that you have to actually. So you pick all the color bottles, okay, and simply when you're putting the cannula, you can say, putting 2 cannulas and I will take all the blood samples. Okay, you're picking the bottles. By doing this action, your examiner knows that you have picked all the bottles that you need, okay, and you have taken all the blood samples and saved. Okay, if you want to control the heart rate, if you want to give any antibiotics or any medication, always check the allergies. If the patient is unconscious, there will be a wristband. Check it. Okay, there will be wristband with the name when you go inside. Okay, check the allergies. Normally there is an allergy band on one side at least. Okay, and most of the time it is red colored strip. Okay. So you see a white band on one side and red on the other side, or maybe both on one side. So red means the patients are allergic, where they are known to have allergies. If this is a new allergy, the patient didn't know, they may not even know.
So we need to memorize which color is used for.
For the SIMMAN, no. Not for the SIMMAN. For PLAB, yes. Because there are few scenarios where you will need to know what color man and what blood sample is. Okay?
And what about tenderness? Do we need to know the color?
You don't need to remember the gauge, but you need to know that the cannula that you're going to put in the patient should not be at least blue or yellow or orange. Okay? It should be at least pink or green or grey, but you don't need to know the numbers. Okay, like 18 days, 16 days, 15 days, 12 days. Okay? You don't need to know about it. Okay, the fluids will be there placed. Okay, they will have their proper names. Normal saline or 50% dextrose or glucose or 20% glucose. They may appear same, similar. Examiners normally come and see if you are handling what you are handling. So, for example, you want to give the patient normal saline, but in anxiety, in the panic, you picked something which you felt or you thought that I'm just dramatizing, just showing that I'm doing it. But by mistake, you picked the glucose and put it there. You will be down. Examiners come and they may come and see. Okay, what did you have? You say saline. You say saline. Knock down. Okay, mistake. Instead of giving normal saline, you give some dextrose. The patient will develop further hypertension. You cannot be careless. Okay? There will be the medications, okay, like salbutamol, naloxone, morphine, like those kind of things, with stickers on it. There is no actual medication. Okay? They may be just simply expired pencils and markers, okay, with the cloth with the sticker on that, with the label, naloxone. This one, adrenaline. There may be empty syringes with the stickers on them, so you assume that they are actually the drugs. Okay, you're meant to be looking for the drugs on there, and whatever you want to give, say for example adrenaline, you do not simply express that I want to give adrenaline. You need to actually go and pick
So
from
we
the.
need to memorize the dosage.
Yes, these are we are talking about the life-saving person. Okay? So this is why I said you are not enrolled in our courses, right? Yeah. So those who are enrolled, you can access on the course. It will show you. Important life-saving drugs. So there is a chart on that. Okay? So you can go to them and take this snapshot. But you can always use this.
So I'm waiting for result.
Huh?
So I'm waiting for result.
Yeah, no problem. Is it making sense? So just pick whatever they may just write on here. That's rules. Okay. Don't think that it's a duster. It's a text rule. Okay. That's all. Ready? Okay. Now Dr. Saad will be leading. I'll be just setting on this here. Where is the stethoscope? I'm sorry for missing a few takes because I've been very busy. I tried to make sure that everything is ready by tomorrow or the day after. Show your hand. Okay. You need to show your face as well as this thing. Yeah, it is registered. Yeah. Let's try to register Saudi. Okay, we are happy with that. Yeah. You okay? Okay, right click.
So here is your case.
Leave that over here, so you don't need to worry about it. Just do this one, yes.
So I want to open anaphylaxis case so that we can read the scenario.
Yeah, so go to the list.
Yeah, where is your case?
Okay, now go down PLAB scenarios. PLAB scenarios.
Yeah.
PLAB scenario.
Begin reading your task.
Do we have a trolley? Trolley है?
Just 1 minute. Sir, I want to just
Begin.
Just wait, solve just wait. 2 seconds. Do not show them in the beginning. Sadia, that monitor is for you, okay? Don't look on this, and this is not for you, okay? That monitor is for everyone, okay? That's the patient monitor. This is an examiner's monitor.
Begin.
Hello, good afternoon, Mr. Roy. I'm Dr. Sadia, I'm one of the doctors in the department. Are you alright?
I don't feel well.
Can you tell me what's going on?
I'm feeling shortness of breath.
Okay. How long? Can you tell me since when are you having the shortness of breath?
I'm feeling difficulty in breathing, doctor.
Okay, Mr. Rory. I would like to check
Oh, I can't breathe. My chest hurts. Hell.
about it. Okay, can you tell me what's going on?
I'm feeling shortness of breath. I'm feeling difficulty in breathing, doctor.
Okay, Mr. Rory. I would like to check your.
Hell.
About it. Okay. Can we start this again?
Carry on, carry
Okay,
on.
okay.
This is not the last mistake that you made.
Okay, so Mr. Rory, I would like to check your mouth. Okay, isn't it?
Kindness, sir.
Okay, Mr. Rory, I can see you're having a fever. I would like to see for any rash.
There are few rashes.
Okay. Mr. Rory, I think you're having an allergic reaction to something. I would like to give you penicillin.
Oh, I can't breathe in my chest hurt. Help.
Everything.
Okay, given.
Can I please have a look at the oxygen levels? Okay. Please speak to right. Okay, Mr. Rory, are you feeling better now?
Yes, sir.
Okay. Now I would like to expose your chest. I've made sure the chaperone is present inside the room with me. Okay. It seems that your breathing is fine. Can you please breathe in and out for me?
Oh, I can't breathe in my chest hurt. Help.
Okay.
Resonant. Bees. Bees on both sides.
Okay, Mr. Rory, I can see that you're having bleed. Okay. I would like to check your respiratory rate. Okay.
No, 28.
20. Okay. Okay, Mr. Rory, I'm going to
Why are you not able to show?
Sir,
Click on the ECG.
Mr. Rory, I'm going to give you oxygen. Okay. I would like to check the oxygen and the respiratory rate again. Okay, well, Mr. Rory, it seems that your oxygen levels are good now and your respiratory rate is also good. Now I would like to check your peripheries, your fingers. I would like to feel your fingers.
2 seconds.
Okay. I would also like to check your pulses.
Present. Present.
Okay. Well, it seems that your pulses are good, Mr. Rory. Now I would like to check your blood pressure. Okay, it seems that your blood pressure is dropping. Mr. Rory, it seems that your blood pressure is dropping. I would like to give you IV fluids immediately.
Is that actually the blood pressure?
Sir, it's 42/1.
Okay, I would
Is
like
it
to put the
actually
cannula.
blood pressure?
Yes, sir, it's
I would like to put the cannulas
It was very important.
and give you fluids.
2 minutes remaining.
Okay. Seems that your pressure is good now. Your pressure is rising. Now I would like to check your temperature. Okay. Okay, Mr. Rory, it seems that you're stable now. Everything looks good. Your pressure is fine. Your oxygen looks good. And your pulses are also good. Your respiratory rate is a little slightly low. But we're not going to worry about that. Now I'm going to check your glucose level. Mr. Rory, are you feeling better now?
yes, sir.
Okay. I'm assuming this is checking the glucose level. Examiner, can you please tell me how much is the glucose level?
Glucose is 5.
Okay. Okay, now I would like to check for any nails. It seems that the rash is disappearing. Everything looks good. Mr. Rory, I would like to check your mouth again.
Tongue is swollen.
Tongue is swollen again. Okay, Mr. Rory, I would like to give you another epi shot. Okay. Well, examiner, it seems that my patient came with an anaphylactic shock today. His pressures were dropping, his oxygen levels were low, his pulse was also dropping. I gave him oxygen. I also gave him EpiPen for his anaphylactic reaction. And I also maintained his pressures by giving him IV saline. Thank you.
Move.
The time of I didn't check placement for the chest bones again. Are the needles gone? Okay. Thank you.
How was it?
No.
I think you.
I think practice makes perfect.
Yeah, I think you put the ABC. There are few things can be mentioning of the rules. There was a bit of delay starting the oxygen. Okay. Our driver was also very bumpy, extremely bumpy. Okay. Unfortunately, there's a value. This happens when you sit behind anybody.
So even practice makes perfect.
Yeah. I just want to show it. He didn't use this software. This is a new software.
So sir, I want to feedback.
Yeah. So oxygen should be started early when you knew that the patient's oxygen was 92. You should start. As I told you before, we should ideally start as soon as you assess a patient's airway, even if it's 94% start the patient oxygen, 95% start the patient oxygen, 96% start the patient oxygen, because this is what we are aiming for. Okay? Above 96%, I'm not worried. For the acute PR evaluation, following the news score, okay? News 1 is 94 to 95, so you want to achieve news 0, because all of them in combination will raise the news score. Okay? So to start the patient oxygen as soon as possible. Apart from that, I think you didn't miss very major things. You could have done the registration and so you felt you did check the glucose again.
No, I checked it. I forgot it.
When did you check the glucose?
Let's check it.
Yeah, check the glucose just now. That's very important. Now, I think Dr. Saad and you go forward what was the actual situation. Who we are dealing with? What's the scenario? It's not anaphylaxis. It's an anaphylaxis in acutely unwell, acutely septic patient. So check what's the blood pressure, what's the temperature, okay? All of a sudden I was shocked that the patient's temperature became normal, blood pressure became normal, okay. So make sure that you stick to the scenario. Think about the scenario, what we are dealing with.
Sir, which temperature we have to follow the periphery one, right?
Okay, yeah, the peripheral temperature.
Okay. And I forgot the ECG. That was so important.
Yeah, ECG is also one of the important. No?
Sir, I just wanted to
Sir,
ask.
it has actually, it's following me. Now it's fine.
Sir, in the end, like, she explained everything to you, that examiner, the blood pressure is this. Does you need to do that?
Yes, it depends on what the scenario says. If you read the scenario, please assess the patient, manage him accordingly. This is one situation. There may be the scenarios where it gives you clear instructions. So here she was not meant to be doing anything. without examining. You need to keep your eyes open, okay, and mind present. What the scenario says. Here it says, please assess the patient and manage them accordingly. Then in the next scenario, say for example, let's see what it says. Okay, manage accordingly. Failure. Assess him, manages ongoing problems. At 2 minutes warning, discuss management with the patient. Okay? So, with the patient. There is another prompt that you may come across. At 2 minutes warning, discuss management with Alzheimer's. So, whatever it says, do not assume what your friends are, your colleagues are telling you, what the records are saying, you are managing that. You need to be following this and keep that in your mind, what your task says, and do that. Okay? So, in this patient, ABCD is very important. Okay? Checking the tongue and swelling, rashes, and I'm happy to see that you are warts and you look on the chest. There were rashes and you responded. Different adrenaline. You know how to use it?
Yes. Remove this group there.
Yeah. Okay. This is it.
Here it is.
But you can push it back as well. Push it back. Because this is the clean pen. You press from the sides and simply push. What is this? What is this?
This is the bottom of
Blue for the sky, orange for the sun.
Green. What is this? What is the name of this?
White.
This is the locking key. What it does? Locks. It locks. Okay, it's a locking key of your applicant. Now you remove the key. It has unlocked. Okay, you need to know those names of the parts you're going to teach to the parents, to the doctors. Okay, it's not blue to the sky. That's a rhyme that you guys learn. Okay, there's nothing to do.
Sir, so what is the orange part called then?
Huh?
What is the orange part called?
That's a needle guard. Okay? But you don't need to worry about what is more important for you is that you tell them this is locking key. Okay? If you put the key inside, they will come to the lock. You need to remove the locking key. Okay?
While giving it to the patient, we need to remove the locking
Yes.
key. And after we have given it, so then we need to.
Yeah, then it is a single use. You'll come to that. Yeah, they have already gone through this. That's why I was.
You will take it to, you can take it to the pharmacy and then they will.
You can take. I will organize it.
Okay, I will. Yes.
Alright, okay. So, brilliant.
Sir, I actually forgot one more thing. Now that I'm recalling. When the patient was recovering, I should have asked them that, Mr. Koi, do you have allergies to something?
I think you did ask about the allergy. Yes?
No, I
Yes.
didn't.
You did ask. You did ask.
I did.
Yeah. You asked and you missed it. Yeah, I can remember. Now, if we.
And can I ask one more question? In which scenarios do we check blood pressure in patients?
Every scenario.
Oh,
Every single scenario.
and how to do that automatically?
Let me feel your that. Yeah, put your finger. Let me feel your that. Take deep breath in and out.
Will it be actually related in any scenarios of the
No, not any of that scenario, but in the ADLS that we did, we do as a part of the trauma school.
And sir, will there be any carbon monoxide for it?
No, not visible. That's right. But again, it is still the part of the syllabus. What you need to follow is the ABC. Whatever the scenarios, A, B, C, D, A, B, C, D. Okay. So if we Now just be familiar with this. ECG and respiratory rate from if we collect from that and collect both of them disciplines. आपने ECG पे क्लिक किया तो हार्ट रेट ECG और रेस्पिरेटरी रेट we all disciplines. ठीक है? अगर patient if your doctor wants to know the respiratory rate, there is no respiratory rate. You need to click on the ECG. Okay? It will show everything. Okay? This is peripheral, and if the doctor wants to check the blood pressure, you can press on this. Click on that. We want to change heart rate. Here, we want to change pulse. ABP, arterial blood pressure. Arterial, that's ABP. Okay? That's in those patients who have arterial. Okay, let me change the interface for you. Patient monitor can have multiple. Something this is important. Okay? The monitor may appear like this. Okay? Or it may appear different. But what you need to look for are the abbreviations of the names of those parameters. Okay, this is a 5-way monitor. There may be 3-way monitor. That is slightly simple. It does not give you peripheral and arterial blood temperature. It gives you only one single. Okay, the one that you saw before was for those who are intubated with sedated patients. Okay. However, because your examiners are not with specialists, they are with GPs most of the time. Most of them are with GPs. They may not have those skills. Okay? So you likely find it simple. Okay? And there may be a different view, 4-way. Okay, here you see 3 waves, then you will see 4 waves as well. There's a CO2, ET CO2, endotracheal tube CO2 as well. Okay. So, what do you need to follow? The numbers and the alphabets written with them. Okay. So here you see they are appearing in different ways. If we see this 3-way, that is the position change, the pulse has come down, then respiratory rate 35, temperature has come down as well. Then you see that blood pressure is at the bottom, and BP is a normal blood pressure, or which is a manual blood pressure. Okay, but in the previous one, where there is a 5-way, you saw ABP. ABP is the arterial blood pressure from the arterial line, and there is a peripheral as well. So there are 2 different blood pressures.
Which one should be the
Peripheral, okay, peripheral.
The NBP.
And BP, okay, just one BP is fine. So what we can do is for future, when we use this, but we use this here. There's one big number as well. That's very big. Let's go for the two. Okay? So, have you untick the ECG? What let us be heart rate, respiratory rate, and ECG will be same. SpO2, you don't need to show CO2, otherwise they will get confused unnecessarily. So, what are the normal things that you want to show is these are two things. Whenever you start, for future as well, whenever you start after teaching with them, make sure that they are unticked. I want them to start looking for those parameters, and if they find they are not on the screen, they should ask. They should feel the need of them for the sake of their diagnosis. If we present everything in plate, they will be very happy and they will not be ready for the surprise. Okay? That can happen, and that happens very often. Alright? That's right.
But in exam, he will be asking for them.
If they are already there, you don't need to. Okay, but if they are not there, they may be means you went inside and you found that all the monitors just simply blank. Okay, fast. Okay, I don't check my patient's oxygen saturation. I don't know respiratory rate, blood pressure, ECG. Go like those like things. But if they are, when you go inside, they are already there. You have to simply acknowledge that the senior patient is already connected to them. It's making sense? बढ़िया समझ आ रही है? Now coming back to this scenario, this patient was very septic and he had this incident happen in the hospital. Incident report, we need a discussion with the microbiologist again, we need the blood test repeating, okay, and a new antibiotic, alternative antibiotics for this patient because he is still septic. And we need to give that in a link as well as we need to.
Do we need to mention
Why doxycycline? No, you don't need to. You simply say, I will discuss, or according to the dress policy, I will give different, or I will discuss with the microbiologist and their advice on the suitable.
This one is
Yeah, that's a peripheral, peripheral consumption. Okay? So we can change it. This is a different. All right, Zishan, this is your turn. This is your patient.
Begin reading your task.
All right.
Begin.
Hello, Mr. Davidson. How are you doing? Hello, Mr. Davidson. How are you doing? Hello, Mr. Davidson. How are you doing? The patient is not responding. I would like to check the
give oxygen to the patient. Now I would like to check his chest. Let's do the chest. Normal. Now I would like to check his chest.
This is normal, doctor. Oxygen is normal, oxygen is normal at the moment.
Then I would like to check I would like to check
Peripheral temperature is normal at the moment.
I would like to see heart rate.
Heart rate is rising.
I would like to check the pulse rate and blood pressure and ECG of the
Everything is normal, doctor. Temperature is normal.
both eyes and on the both sides and take the blood samples for CBC, electrolytes and liver function test, kidney function test. Check the vitals of the patient.
Pupils are normal.
Now I would like to check the blood glucose level of the patient.
Blood glucose is 2.
Now I would like to give the patient 20% glucose through the vein.
How much? Blood glucose is
20%.
how much?
100 grams. 75. Hello, Mr. Davidson. Hello, Mr. Davidson. Hello, Mr. Davidson. But it will take some time. Now I would like to get blood sugar again.
Blood sugar is 4.
I'm that patient is improving. Now I would like to check the response again. Mr. David, how are you doing now?
Yes, doctor, I am feeling a bit better now.
I'm glad to hear that. I would like to check the blood sugar again.
Blood sugar is 4.
Mr. David, can you please tell me when was the last time you took the insulin?
I took the insulin today, doctor. I took more than my prescribed medication.
Did you take it with me?
I skipped my meal as well.
You were brought in an unwell state, and when we checked your blood sugar, it was really below the normal level. Because you might have taken the insulin above your prescribed dose, we have given you glucose, and I'm glad that your sugar levels are improving. And do you feel pain anywhere in the body?
Busy again.
Now I would like to
2 minutes remaining.
Not doctor the exam.
my patient came with in an acutely unwell stage. When I checked the response, he was unable to respond. He was not responsive to the pain stimulus, and I checked the breathing, and he was breathing normal. There was no obstruction in the airway, chest was clear. Then I checked his blood
What is
pressure.
your diagnosis? What is your diagnosis?
He was having hypoglycemia.
Okay, so
Maybe
how you manage?
I gave him 20% 75 ml glucose through the vein, and luckily his glucose level improved and he became
conscious, but it will never drop again.
So what is your definite management in this case?
I would look for any causes of hypoglycemia, like infection or any intoxication.
Okay.
Then I would ask him to have some sugary drink or food, and then I would ask him to enter into endocrinologist for adjusting the dose of insulin,
Okay.
and would advise him to take his insulin according to prescribed dose and with the meals left in.
Thank you. So why the patient was drowsy again? So what was the reason why?
Timing.
Huh?
Timing.
Timing of the treatment that we give B complex in those cases where hypoglycemia is because of alcohol intoxication. लेकिन फिर भी अगर मैं ड्राउजी हुआ था क्यों हुआ तो मेरी ने क्या कि he has not asked me to take the sugary food. मेरी 4 पे गई है इसके बाद थोड़ी अब शुरू कर दो दोबारा से होता है पहले से मुझे कहो तो सही sugary food ले लो और मैं अब
the ability to
अब मैं उसमें थोड़ा कॉन्शियस हो गया था ना बहुत ज़्यादा अब तो हो गया क्या था कि जूस ले लो या फिर बच्चे उसके अटैच कर रहा था या ये गोल the third is verbalize कर रहा था okay I will keep an eye on my blood sugar level and once my patient is stable I will ask him to take या उसको patient को कहता है whenever you are stable please take your meal meanwhile if your blood sugar level is low we will give we might give you another 25% dextrose that is verbalize हम वो बोला से ना टैग थोड़ी करने का भूल जाएंगे इसकी जरूरत नहीं है आप सेकंड का अगर देखो कॉन्शियस हुआ बेसिकली आपकी प्रैक्टिस ही है ना रियलिटी थोड़ी है बेसिकली आप ये बताना था कि भाई अपना शुगरी मील ले लो या आप शुगरी ड्रिंक ले लो एटलीस्ट अगर हाफ आईवी दो आपसे तो यार जूस ले लो take some juice have some are you able to take from anything like some liquid or some solid food or अगर मैं liquid है तो take some juice I will ask someone to bring a juice for you. It is ये क्या है स्टेबल कर देते हैं अब इस केस में देखा सामने को लग रहा था कि ये पेशेंट जो है ना वो सेप्सिस में है पेशेंट ये लग रहा था अगर आप सिनेरियो पढ़ो तो लग रहा था सेप्सिस में यही मामला होगा तो again सॉरी अल्कोहल इनटेक कैसे रूल आउट करना अगर जैसे क्योंकि उन्होंने काफी चीजें इतना बता इसमें टाइम लगा दिया कि अगर जैसे आप प्रोफेशनल स्टेबल हो फिर आप उससे एक दो सवाल पूछ लो एक दो सवाल तो मैंने जैसे ग्लूकोज दे दिया प्लीज टेक लेकिन इसमें पेशेंट ने तो क्लियर कट हिस्ट्री दी ना हाइपोग्लाइसेमिया के लोगों की बात ही नहीं की पेशेंट जब उन्होंने मेरे से बात पूछी मैंने तो कोई बात की नहीं मैंने तो उन्हें क्लियर कट हिस्ट्री दी कि मैंने मील मिस किया है मैंने इंसुलिन ज्यादा ली है इसलिए मैं खुद पेशेंट अगर पेशेंट आपको दे दिस फैक्टर दे रहा हूँ तो फिर कभी शुरू में डिस्कस करते हैं क्या क्या करना चाहिए एयरवे से शुरू करके पहले रिस्पॉन्स चेक किया I think I have to speak English because it's going live so we have an international audience so what we need to do so first thing is that we need to check the response that is what we need to do at the first place okay the camera is over Okay, so stand with me. Okay, so what you need to do, you need to check the risk. You need to check first the patient is conscious or not. He did very well. Confirm his identity from here. Then check the airway. After checking the response, if there is no response, then check the airway. Open his nose because he has not checked the airway at all. So please check the airway. That either there is a swelling or something going on in the tongue or in the inside the mouth. So he missed that step. Okay. Or then what you need to tell in the breathing part. After checking the response, he went there, and after that he did everything in the breathing part was right. Okay, and then he was checking the thing on the meter as well. That was a good thing that he was doing at that time. And in the circulation. I don't know why he was spending too much time and he missed the peripheral coldness of the pulses as well. So please
That's
check,
important.
please check.
Check the pulses.
Yeah.
in
So,
order.
so best thing is that you first you can go from your limb, and then once you have covered everything, then go here and check the thing, so that you will not forget anything. That is the easiest way. Go from the capillary till time, check the pulses, check the BP, check the temperature over here, then check the port dietary, then go come here and check the pulses. So he missed that. So he was confused about the diagnosis, so I think he was struggling again, and that's why he spent too much time. And then he entered into the D, he checked ABP, that was great, and then he checked about the people. First check the people, and then you enter the group for the activity value of 2. At that time, that was it. That was what he performed. He did well. But once you have done the management, it does, sir, as I told you, that your purpose is not to just treat once. Your purpose is that now you have to maintain that level as well. So I was telling him that the patient is now again drowsy, and he did not bother that, and he was not trying to find out where things went wrong. So once the patient is conscious, then you can say, okay, please take your meal, so that otherwise what will happen if you will not take the meal? The blood sugar level will abruptly go down. Because he was not saying that.
The patient may not be able to eat immediately. Okay. As soon as they recover, okay, it is important that you keep checking. And most of the time, they need second dose or the third dose to become more stable. Okay, once the patient is more stable and able to eat and drink, then you can ask them to stop.
So what you can 25%. 25. So what you can simply say extras. Meanwhile, if you are able to take food, please take food or some sugary drink. So that is what you are telling your examiner, that you know what you want to do.
How is alcohol
Alcohol can also cause hypoglycemia. So in that case, you need to get B complex.
In this case, can you do the cause?
In this case, the cause was not. I told him when he was taking my history that I have taken more insulin today than I was advised, and I also missed my meal. So that was a different scenario. Alcohol is a different scenario. That was she was asking about
Alcohol can also be the cause of
hypoglycemia.
in alcoholic patients, we normally treat them with the dextrose. We don't give them glucagon. It's not contraindicated, but it is useless because it does not work in alcohol. We need to give them thiamine and peptides. Thiamine and chloride is a peroxide. Gabrinex is sorry. Tachycardia is secondary. Okay. Another thing, sinus tachycardia is not the disease. It is most of the time secondary sinus tachycardia. Okay. Can be because of anxiety, stress, can be because of the pain, can be because of derangement of other issues in the body. Okay. So we don't treat the sinus tachycardia now. Okay, we treat the underlying problem. In this patient, if the patient is unwell from the hypoglycemia, or the patient may be unwell from the pain can also give the sinus tachycardia, stress can give the sinus tachycardia. Hyperthyroidism can give. So we treat the thyroid problem in that. We don't treat the tachycardia. Sinus tachycardia are most of the time physiological, not pathological. The pathological problems that we see are non-sinus rhythm arrhythmias, where atrial fibrillation is a pathological, SVT is a pathological, atrial flutter is a pathological, BF is a pathological. So these are the pathological. This is most of the time sinus tachycardia is physiological.
So it will get better by itself.
Yes, you treat the patient's underlying problem. Symptomatic patients with asthma, they come with severe tachycardia. Okay, so in that case, you treat that status asthmaticus, and the asthma patient's pulse will improve.
It was mentioned in the patient can you respond like the doctor was like?
So again, when you come inside, you show them with their name, okay, ask if the patient gives you response, it means the patient has changed, yeah, has slightly improved. Okay? Do not get confused. You then follow what you see. Confirm is their name, okay. It was Mr. Davidson, how are you? I was called to see, I was told that you are not responding. I'm glad to see that you're talking. Alright, acknowledge that. But you, at the same time, you want to show your examiner that you read your task. So, how are you feeling? I was told that you're feeling not well, unwell. Okay, tell me what's happening. So, you continue from there.
In the management part, how many times they have to repeat the IV
There is no limit of the time. Okay, so we aim to keep it 4 and above.
It was the wrong answer if I said that I give the patient text or treatment.
Yeah, you can give it.
If he said that he would repeat and I was thinking about
No, that is not wrong. That is not wrong.
Yes.
Okay, now it's up to you how you take it. Or you want to show your examiner. You can say, Davidson, your glucose is low. I will give you glucose infusion until it comes to 4 and above. Okay. Your examiner is happy. But if you take the indirect route, we want to see what is the next plan. Next plan. So what you say, I will give you bolus. It may come up to 2.7. Alright? And then the examiner would want to know, okay, let's see what he is going to do. You keep it 2.7. Okay, then you recheck it again and give another bolus. Okay, examiner may say, okay, talk to himself, let's see. As he repeats, let's go back again to check the input. And what is his intention? When you talk to the examiner may ask you, okay, until what time you will continue giving the boluses, or what are your target glucose level. So we must expect the answer that it should be 4 and above. But if you, while you're treating the patient, if you say, okay, Davidson, I need to give you the infusion and I want to keep it 4 and above. Your glucose is very low at the moment. You have already given the answer to your examiner. Okay, you have not left anything. Does it make sense? And both of them are right.
And how should I discuss the management? Like they are too specific. Last 2 minutes are.
That's the technique. That she wants to know how to describe the case to the examiner.
Yes.
S-bar.
So there's an S-bar. Description or presentation is different. Discussion is different. Okay. So here you are going to go straight to the management first of all, quickly. Okay. So I was called to see Mr. Davidson, 67 years old, admitted with the UTI, and he was recovering. All of a sudden he deteriorated, and I was called because he was not responding. When I went on my assessment, the patient was talking to me. When I entered, and on my assessment for the ABCD protocol, most of the parameters were fine, apart from there was a marked hypoglycemia, and it was 1.7 or 2. I started the patient immediately on, started giving dextrose. Okay, and the patient's glucose improved. He was feeling well. I will continue assessing the patient up until the glucose reaches 4 and above, and if for the assessment, make sure the patient's insulin and other anti-hyperglycemic medications are reviewed. Okay, I will also consider referring the patient to the diabetic team and do the HbA1c. Okay. What you want to learn from today is application of ABCD, checking all those parameters in that particular. You cannot control every single thing in one day. Okay, I have taught more than 1,000 candidates. Okay, and more than 10 years. Okay, you may not be as fluent as I am. Okay? But don't worry, if you start hitting 50% of what I'm doing, okay, you will be already at. Okay? Don't worry. And all this came with the practice, regardless whether you are applying practice with you or with the real patients. Okay? So we need to.
Good question. As a patient, we started
What medication do you change? I told you tachycardia is physiological. If you treat the patients with lung problem, that tachycardia will settle. Okay? If you shout loudly on a child, he will develop tachycardia from 80 to 150 immediately in 1 minute. Do you give them these bicycle load? You calm them, cut it them, okay? No worries on that, okay? Even now, let's go eat some more sauce. Okay, good go. Tachycardia will come. Okay? So, sinus tachycardia, most of the time, is just a symptom. It's a physiology. Okay? You treat underlying problem and it will settle. Don't worry about it. Okay? And always follow ABC. B comes first. Breathing B's. Tachycardia is second in C. Okay, B is in D. Tachycardia in C. You treat B. Okay, C will improve. Is making sense?
Even if it happens because of the medication.
Oh, yes, of course, we know that.
Yeah.
It is quite expensive. Okay, we never give them salbutamol with the beta blockers. Yeah, we know that. Okay. Give him salbutamol, someone nurse comes and says, doctor, his pulse is very high. What do? Do we normally give him bus floor? No. I know that we give him salbutamol, don't worry about that. Isn't it? Yeah, just continue on it, it will settle. We know that effect is very constant.
The second question is that in a conscious patient, I will come and introduce myself and talk to them. But in unconscious patient, I will have to introduce myself to the
You just go to the examiner. This is my TX number. I'm Dr. Sadhya, and I understand the class. Simply come. Okay?
once the patient regains the consciousness and unconscious,
Yes.
I will tell that I will.
Yes. Okay, I'm from the doctor. My name is Dr. Sadhya. Don't worry, I'm here to see you. You are not well. Just a few seconds ago, few minutes ago. Please don't worry, you are in the right place, in safe hands, and I'm here to look after you. Okay? So, did you want to know what happened? Okay? I'm happy. When I came, you were unconscious. The glucose was very low. You just give them a brief overview of what happened. And if they are interested in go, maybe what caused the doctor is going to happen again. So, okay, just mention it. Just mention it.
So if we go through all A, B, C, everything is normal. We encounter a probability.
Yeah.
He has hypothesis. Then we give him glucose. Do we need to do that for A?
Yes.
Even if it is a normal.
Yes. Always.
So when we told the patient that your sugar level is low, then we're going to ask, do you have any diagnosis?
Ask them. See, these are not.
Or do we have to be direct? Do you take insulin? Or did you drink alcohol? We can't ask that.
But you can ask, are you diabetic? Is any particular reason you have very low glucose? Did you have any idea what could have caused it? Did this happen before as well? So you can ask them. Okay? But do not simply assume that it's essential. There can be multiple reasons. Okay?
Jacket.
Begin reading your task.
Steps are not like
Begin.
Hello, Mr. Davidson. I'd like to check my patient name. Mr. Davidson,
Yes, doctor.
how are you feeling?
Doctor, I'm feeling so dizzy.
Be loud, doctor.
Doctor, I'm feeling that I'm a bit confused.
Okay, all right. Okay, Mr. Davidson, I'll start by examining your throat.
Okay.
There is no.
I feel really bad.
Yeah, just clear.
So I'd like to see the SPO2, it's 95.
This is not yours.
I'd like to see the SPO2. Saturation of oxygen in your blood, Mr. Davidson, it's about 95. But I'd like to give you oxygen and I'll attach that.
Thank you.
Thank you.
So now, Mr. Davidson, I would like to examine your chest and I'd like to uncover you a little bit. Is that fine?
Patient is confused. He carry on correctly.
I'd like to check your neck,
Clear,
chest movements,
equal, symmetrical.
auscultation,
Yes, no resonance. Repetitions. on both sides.
Mr. Davidson, you have capitation on both sides, and now I would like to attach two large both cameras. I'd also like to see your breathing rate. I'd also like to give you some mobilization. Are you feeling any better?
No.
Okay. I'd like to check your
I
calorie.
don't feel well.
Okay. You will start feeling well, don't worry.
The refill time is 4 seconds.
Time is 4 seconds. Okay. Mr. Davidson, I'd like to attach an IV fluid to you.
Thank you.
So,
Okay, yeah. Where is I? Good. I'd like to see your pulses, peripheral pulses. They're present. And their volume as well. They're weak. Okay. I'd like to check your temperature, peripheral temperature. Peripheries are warm. I'd like to I'd be checking your heart rate and your pulse. Your pulse is a bit more, and your respiratory rate is also very high, and you also have temperature as well. I'd also like to see your ECG.
I don't feel well.
Yeah, you will start feeling well. Just give me a second. So, sir, I would like to give him antibiotics as well. Okay. What antibiotics? I'd like to give him broad spectrum antibiotics. Oh. So, shall we follow the trust policy? Yes, we will follow the trust policy. Okay, that's good. Yeah. So, Mr. Davidson, I am giving you some broad spectrum antibiotics, and you will really feel well with them within a few seconds. Okay?
Thank you.
2 minutes remaining.
Okay, Mr. Davidson. So, okay, sir, I would like to share the management plan with you. Okay. Yeah. I would like to share the management plan. Alright, so the patient, Mr. Davidson, he got confused and the nurse called me, so I just came and saw him. Who is Mr. Davidson? Sir, the patient. So, where did he come from? Sir, he was admitted. Oh, yes. Yeah. So, sir, 69, his breathing seems fine. In his circulation, his capillary refill time was increased, and also there were crepitations in his chest. Okay. Yeah. What is your diagnosis? Sir, it's pulmonary edema, and it's like like heart failure. But how do you manage the heart failure? Sir, okay, I'll give, sir, as you can say, converting enzyme inhibitor and beta blockers. Alright. And we'll give him some furosemide, so that the fluid drain. Okay, what is causing the high temperature? It seems to be sepsis as well. Right. So what is happening? What is causing the confusion to the patient? What is your one diagnosis? Sir, it's sepsis. Okay, so you need to go to that, isn't it? Right. Yeah. So far, very good for following the parameters. Now you see, despite having so many confusions in the hindsight that you have, you manage the patient very well. Okay, you manage the patient following the parameters. High temperature, you give antibiotics. If it be fill time was prolonged, you give antibiotics. Okay, you manage the patient to save the life. Okay, that is the role of following A, B, C, D.
E. Okay, you may get lost into multiple confusions.
So do we need to take blood tests before antibiotics?
Yeah, we can talk. Okay, now let's go back to the feedback. That was very good. I'm happy to see that you followed the Now there is a possibility that you may miss doing a few things as you put into E and E, and if your task says discuss with the examiner, you can always mention that I've done this, and I will complete my assessment by checking patients D and E. By all means. Now, this patient, what happened? Just focus on this. What happened to this patient? He had a pulmonary edema. Did not defixate it. He had pulmonary edema and he is being treated for that. He is treated already. Possibly he has been given furosemide, a lot of furosation. Everything is. You can believe because the patient is confused. Okay? There are multiple things may be happening. It can be hyponatremia when you get diuresis, the patient may develop hyponatremia that can cause confusion. The patient might have had hyperthermia, sepsis, as in your case, the patient developed that actually sepsis. Okay? Because the patient is over dehydrated now, over treated after diuresis, he developed severe dehydration and started having symptoms. It was more likely urosepsis could be, but it can be chest sepsis. Regardless of wherever sepsis is following the parameters A, B, C, D, E, following the parameters of pulse rate, heart rate, and blood pressure and the temperature. Your decision was to give them antibiotics. Does not matter what was going on. There was an infection and there was a risk of the time. And that will make the patient better. Does it make sense? Yes. So, following the A, B, C, D, E is the key of any acute unwell patient. This is why those guidelines are there. Otherwise, she may treat this patient differently, you may treat the same patient differently, Zishan may treat the patient differently, Mariam may treat the patient differently, Ahmed may, Abdurrahman may treat the patient differently. So, Resuscitation Council has given you, after a lot of research, given you those guidelines, A, B, C, D. It might be just on the scenario says this, that when you come to the patient's hypoxia, tachycardia, blood pressure normal, pulse, and chest is clear, you don't know whatever you suspect. It could be PE, isn't it? Yeah. Based on parameter. Then you forget about this. Alright? This is just to get an idea, but it may or may not be fully linked. Okay? So, what is linked is ABCD. And those parameters in that particular order. Okay? My primary teaching was on the SIMMAN since we started another academy. I'm very much into it after seeing so many candidates, after teaching this so many times. Okay. I reached all those formulas and conclusions and the parameters to make the things easy. Okay. It is not just to help you pass those scenarios in your exam, it is also to enable you to utilize your skills and help the unwell patients. Okay. And you will get into a different context. Just follow those parameters. Progressing into the task and trying to complete the ABCD is always important. If you cannot do that, you need to make sure that you do the key treatment. Always a key treatment. For the sepsis, there are some, every single scenario has one or two key medications. Hypoglycemia, the key medication is a glucagon or dextrose. Okay, sepsis, key medication, key treatments are IV fluids, antibiotics. Anaphylaxis, key treatments are oxygen and adrenaline. Okay? So always make sure that you do the key treatment, and then if there is anything which is left, that will be just given and forgiven. Okay? Don't worry about that.
We made one mistake. We had oxygen level low and none of us like it.
Yeah, I know. ABC is very important.
Yes.
Okay? ABC is very important. Do not think from that point. From the examination point. Think from your own point of view that if I have ABC, I will get that long list, that I will know the potassium, I will know the sodium of the patient, I will know the pH of the patient, the lactate of the patient, base excess, okay, hemoglobin level, PaO2 and PaCO2. There are so many things that you will know, and it will be helpful for you to help the patient.
And the patient was likely to have the whole dose of furosemide also.
Yeah.
So can I mention the management that I would like to reduce the dose or temporarily stop the furosemide?
It is always good. It is always good to emphasize and elaborate your actions. It's a good idea if you want to mention that. You can say, I could see from the beginning that the patient was initially admitted for the pulmonary edema possible. The patient might have been given furosemide and I will need to review the medications. Okay? Yeah. Now, when you present the patient, you said, Mr. Davidson, I don't know who is this. Okay? So Davidson was confused. Who is Davidson? Can you get it back? Mr. Davidson, 69, already admitted with the pulmonary edema and he was being treated. I was told to see this patient because he became confused. On arrival, on my assessment following A, B, C, D, E protocol, I found that the patient had hyperthermia, tachycardia, and he was borderline hypoxic as well. I started the patient on hypooxygen, okay, and I implemented or started or commenced Section 6 protocol. I will carry on my assessment. I still need to complete the D and expose the patient to complete E, and I will consider doing all the investigations, including ABG, chest X-ray, blood culture, urine culture, all blood investigations, including UNEs, LFT, CRP, and blood count. Okay, and do the proper assessment. I will continue monitoring until the patient starts doing well. If needed, I will involve other teams. I will make sure that my team is also there. Okay? So,
specifically asked about the categorization of the patient and ethical investigation of sepsis.
you can do that.
I had to mention it, or in which part?
See, there is no have. Okay, there is no mandate that they should do this. You want to show your own skills. You don't have to. It is always good. If you mention that I need to monitor sepsis 6 means you are implementing oxygen 3 in 3 hours. Okay? That means essentially putting the catheter by default. Okay? So I will implement sepsis 6 protocol. Okay? And make sure that we monitor the input and output. Okay? And this becomes more important, especially in such patients who have community. Okay? Always think that the clinical spectrum of the signs and symptoms of the treatment of the patient, the management of the patient, what can be worrying for you, what can be disastrous for the patient. Always think and try to include as much as you can. Okay? And the more you do, the more safe you will be. You will appear in your examination. Okay? In pulmonary edema, we normally the treatment.
So that is what we were asking because we hear salmonella
Yeah.
and you raise the heart rate as well.
Yeah. So yeah, it was actually we do not give salbutamol for practice. Okay, salbutamol is for the V's and the bronchi. Okay. So V's and bronchi is because of the bronchospasm. We give it because we give them salbutamol to treat that bronchospasm. Okay, for the crepidation to happens, we need to consider this antibiotic, especially if it is one-sided. If this has pneumonia, especially if it is in combination with the high temperature. Alright. Apart from that, we did most of the parameters. I'm really happy with that. This is just a first day. Okay, we had plenty of time. Make sure that you know those who are already.
My question is not they will be fluid overdose because edema already over.
But now there is a capillary fill time of 4 seconds.
If that was not the situation,
Then, okay. Then what are you going to do? If the patient has a sepsis and the patient already has pulmonary edema, capillary fill time is normal, what are you going to do? Boluses, small boluses of 100 ml of fluid and on the eye tissue. What they will do? They will give iron drops. Okay, they will give iron drop because we are limited and restricted by the heart failure, but we are not allowed to give loads of fluids. Okay, you mentioned that, and it is important to do the echocardiogram in such patients. Okay.
Blood pressure can be acute.
Huh?
Blood pressure of the patient. Like if the patient is in sepsis, its blood pressure is low. If the patient is like fluid overload due to heart failure, then
It can also be low. All right. Carry on. Do a bit more practice. I will take the break now. Okay, I will still be around, but I have very limited time. I have a few meetings and few things to do before I fly back. Okay, and I couldn't see my mom properly since he came or see my family. Okay? So I will leave you alone now in his safe hands. Okay? Yes, today's aim should be working on the parameters. Just the parameters. Make sure that your brain is primed in all those boxes as you go along. Okay? That is the aim. And once you know your parameter, how I am so confident because I know the parameters. Then fill in the gaps. The dose of the medication is not a problem. That you will know very quickly. It's just a one single page chart of the medication. Then you can रटे में मांगा रहे आप सब ऐसे नहीं है ठीक है but you need to build the confidence by following parameters. If you miss any single parameter, there are the possibilities that you will lose whole scenario. Okay, what matters in such situation in SIMMAN is the overall outcome. Okay, what's the eventual outcome, overall outcome? Okay, now following A, B, C, D, E is very important, but it does not take the precedence on the key medication to key treatment. If you did A, B, C, D, E very beautifully to a hypoglycemic patient, but you did not treat hypoglycemia, what will be the overall outcome? A dead body, isn't it? A beautiful dead body. No touch, no CPR, no lines, no cannulas, no bruises. Beautiful, clean. I don't mind that. I would prefer to have a bruised patient, multiple stabs and everything, but alive. Okay? So this is what you need to do. Okay? A, B, C, D is for you. Make sure that you don't miss anything. Okay? You treat whatever should be treated, and whatever is reversible is treated. Alright? So, best of luck, enjoy your session with Dr. Saad. Saad will be busy from tomorrow on. Okay, so you missed your day 1 on the course. No. So, day 1 of the course is the foundation. You starting the full course, isn't it? So there is a course today which is at the moment going on. Day 1. Okay, that's they are working on basic structure. So they start with the foundation part. Our course is foundation for 10 days, then the smart course. This is only the part of the smart course on Mondays. Okay, so you did this. It's very good that you've done this. Okay? It will be very easy for you to catch for today that you missed on the foundation. Tomorrow you will be doing the foundation part, and the foundation part will be done by your Saad. Okay? It is done today remotely because Saad was okay? But tomorrow we will carry on, we will have different activities, but we will carry on face to face. Those who want to join or who are joining from tomorrow, you are most welcome to carry on. Okay? But the Saad will be teaching history and days. Okay? Any day which is missed, we can take that. Alright, good for you.
You